But that's okay. You'll see Sakina in a couple of minutes' time. Let's talk some very, very serious issues. The National Health Insurance Bill is a step closer to actually becoming law. While presenting his budget last week, Health Minister Dr Zweli Mkhize revealed that the document had been approved by Cabinet. He also gave details of how universal healthcare for all citizens would bring major changes to the sector. To discuss this further, from our Pretoria studios, we are joined by Dr Sipho Kabane. He's the CEO and registrar for the Council for Medical Schemes. Good to have you, Doc. Thanks very much for being our guests.
Morning, Leanne, and your viewers.
So, the department says it has already enrolled 42 million South Africans in the health patient registration system. How ready is the country to introduce NHI?
Well, from the regulator's point of view here, we believe that these pronouncements by the minister signal, a degree of urgency in the implementation of the NHI. We are confident that the entities that we regulate will look at the detail of what sits in the bill and also in the implementation plan and find a way of supporting this here. Because there's overwhelming support for the NHI.
Yeah, overwhelming support, but there's also the other side of the story where there's still a lot of worry about NHI and it's working. Obviously, there were 7 steps and a lot more clarity given by the health minister as to how it's going to work. Perhaps you can talk a little bit more about the actual workings of NHI.
Well, we understand the NHI to be a financing mechanism that ensures that the total population of South Africa gets access to quality health services based on need and irrespective of the socio-economic circumstances. This for us means that the current skewed the funding of health will be cleared, because currently we've got 16% of the population enjoying up to 45% of the GDP, and the 16%, having a larger share of that percentage of the GDP. Yeah.
Please continue.
Oh, I was going to say that 84% of the population actually gets a lesser portion of the GDP. So we need to address this health funding inequity. And the only vehicle available for doing that here is through the NHI.
It certainly is. I mean, and there is a very bad healthcare system, and we cannot deny that, and I think everybody is looking at it and knowing that something desperately needs to be done. What the minister did say was that, some people criticizing and saying, rather fix up the hospitals first, try and get adequate staffing into the hospitals, try and get medical medicines available to people that actually go there, sort out the medical system the way it is now. But his response was, no, we've got to bring NHI in before we can fix any of that. How does that work? I mean, what is your understanding of how NHI will actually fix up what is bad currently?
Well, my understanding of the minister's pronouncements, particularly in the budget speech, was that we need to fix the quality of public health services whilst at the same time implementing the NHI. That's why we were very supportive of the announcements that the public health sector is going to be employing 2,600 new employees, and another 2,600 interns will be made permanent. There were also plans to improve infrastructure, equipment, and the supply of medication. And as we listened to this, we also heard him say that an NHI unit will be established within the National Department of Health, which will develop an implementation plan that will make things clearer what will happen in the transition towards universal health coverage.
Yeah.
So we see these two interventions as is happening concurrently and not in a sequential form.
All of this, of course, takes a lot of money. Some of the costs, we don't know the actual costs that the NHI is going to come in at, but just for a startup program for all of this, we're looking at about 232 billion rand. This, of course, it's a lot of money, and especially in an environment where South Africa is not doing so well or at all, actually, economically.
Well, we have heard the minister himself explaining why we cannot wait until we are rich enough to implement the universal health coverage. He gave examples of countries that have implemented a similar kind of health reform without having all the resources that it needed. And if I'm not mistaken, he quoted the United Kingdom as well as Japan as those countries that did not have to wait until they had sufficient resources. And I'm of the view that, this country also needs to move in the same direction.
Yeah. It certainly, I did read some of those case studies, and Japan is very impressive for how they managed to turn things around. But one of the biggest problems, and I think many people are worried about that, is that South Africa unfortunately does come from a background of huge corruption, and it is still corruption that exists right now. Many fear that with this amount of money that's going to go into this pool or this fund into the healthcare of South Africans, this is just going to open up a can of worms of mass corruption and looting. Is this a concern that's been raised?
Leanne, I think everybody needs to be concerned by corruption or the possibility of corruption visiting the NHI. But I think given the recent developments in terms of how the country, through the president, has clearly articulated, a view that is anti-corrupt, and with all the commissions that are going around dealing with corruption, and I think our awareness of all of these impacts on the NHI means that we need to be doubly sure that we eliminate whatever corrupt practices that may visit the NHI. And part of this is ensuring that the fund itself is established in a manner that does not allow for corruption. And there is a checks and balances to keep whoever is running the fund to be accountable, and ensure that there's transparency in the manner in which the fund is run, the contracting with service providers. I'm confident that we're not going into the universal health coverage in the form of NHI, without having considered all of these risks. And I'm certain that we will manage them.
Yeah. Let's talk about medical aids. They obviously are not too confident about this, and they have expressed their worry and concerns for obvious reasons. But how do we get their buy-in, and what will medical aids look like once NHI is introduced?
Well, Leanne, I think we need to start from the point that when the white paper on the NHI was issued, it clearly articulated the view that there are going to have to be massive changes in the health system for both the private and the public sectors. Now, having accepted that here, it means we need to also note that the private sector will be affected by the implementation of the NHI. But I think the important thing is that we've got the medical schemes bill that is in the pipeline. And that, for me, signals that the changes that are going to happen in the medical aid industry are going to be based on legislation. And we have been told that all the changes will be clearly articulated in the transition and implementation plan. And I think there will be certainty in terms of how these changes will be phased in here.
Yeah. Yeah. You know, I'm bringing in a tweet from one of our viewers because I think it's vitally important to hear from South Africans. We can talk, but this is what they have to say. Theodora actually saying it's not just better health facilities that we need. We actually need staff that want their jobs. The horror stories we can tell you about what happens in public hospitals after 4 p.m. daily would break your heart. How are we going to fix that? This is a very relevant question. We can maybe fix the healthcare, but those that deliver the service of healthcare, how are we going to fix them? How are we going to pay them better? How are we going to make them actually care about South Africans?
Well, Leanne, I think the pronouncements by the minister in terms of appointing additional personnel for the health system will go some way towards addressing that. But we've also been told that the students that have been trained in the country, as well as other countries such as Cuba, are increasing in number, and these numbers are expected to fill in the gaps of the vacant posts that we are currently sitting with. The minister also mentioned that there's consensus that the public health sector is underfunded, and that through a consultative process with Treasury, the baseline of the funding of the public health sector is going to be relooked at so that health is adequately funded.
Yeah. Well, we'll wait and see what that all looks like, because I do know that there's a lot to still be done. But the reality is that we could have NHI signed into law by July 2020. So that's next year. NHI could already be there. But I know that during one of the debates and Q&As around the NHI and what the minister had said, the DA came out saying, and to quote them, they said that the NHI pilot projects across the country have actually failed.
Leon, I'm not the spokesperson for the National Department of Health. What I'm aware of is that there was a report that reported on these pilot sites here. And I would love to direct people to go to that report, have a look at it, because that report actually talks about what was planned at the pilot sites and what was the ultimate outcomes of those interventions that were put in place. And I think if people look at that report, it may change their perspective in terms of the failure of the pilot sites.
Yeah. Fair enough, Doctor. I mean, you certainly are not with the health department, and I think it would be good to get them in, actually, to take this conversation further. One final question I need to ask you, because I see that it's sitting on the front page of one of the dailies this morning, and that's the issue of Black and Indian health practitioners that have been dealt a bit of a blow to waging their war against these medical aid schemes accused of running fluk-plus operations. From what I'm reading is that the report says that the case was actually thrown out of court against the NHCPA because it had no legal authority representing the medical professionals, and that some of its complainants were actually found to have engaged in fraud. Do you know more about this particular case and this operation against some Black and Indian professionals, medical professionals?
Leanne, I'm aware that there was a case that was before the courts where these allegations were being tested, and that the CMS, together with the minister and schemes, were cited as respondents. And the case, as far as I know, was thrown out on the basis that the entity that had laid these charges didn't have the locus standi for presenting that case. In other words, the contents or details of and substance of the case was not ventilated. It was just a technicality, that was imposed.
Yeah. All right, we'll talk more about this. In fact, I think it'll be good to get the CMS in to try and clarify what actually happened in court. We thank you for talking to us. I know that this is just the beginning of a conversation that'll be happening for a long time when it comes to NHI and how it affects South Africans. Dr. Sipho Kabane-CEO and Register for the Council for Medical Schemes, reacting to the Health Minister's budget and, of course, developments on NHI. Thanks again, Doc, for your time. Let's take a break.